I am really, really pleased to introduce the person who will be talking about her experience as a baby boomer, Rani Marx. And I need to also just say a couple of words of thanks to Rani. Rani stepped in when we talked about developing these webinars and said, you know, this is so important to get the patient voice out there. She has been a support to me as we work to develop these webinars, and I couldn't have done it without Rani Marx. So with that, I'd like to turn it over to Rani to tell us about her experience as a patient and founder of the Hepatitis C Mentor and Support Group. Rani, are you there?
I am. Thank you, Karina. In 1996, after donating blood, I received a letter in the mail from the hospital telling me they were unable to use it. Something was detected and to contact them. I spent that evening walking around thinking I had HIV, as since I was an infant, I had numerous operations on my hip which required many blood transfusions. Blood was not tested until 1992 for hepatitis. The next day I was told I had hepatitis C. Feeling relieved, I left and made an appointment with a liver specialist. After performing a liver biopsy, he told me I had stage 0 to 1, minimal scarring, and sent me on my way to live my life. At that time, the internet was new, very little was known about hepatitis C, and there were no support groups. My friends and family tried to support me best they could. None of us understood the enormity of what hepatitis C was. I went to another hepatologist who suggested I go on an aggressive treatment regimen, and without enough knowledge, I started injecting interferon 7 days a week. Back then, the only meds were interferon and ribavirin. The side effects were horrific, and I had minimal support. After 10 months, unsuccessful and quite sick, I stopped treatment. That is when I made a promise to myself that I would never let anyone go through this experience alone if I could help them. Shortly after I stopped treatment, the first ever hepatitis C support group started where I lived. It was such a relief to finally meet people who truly understood what I was experiencing and had been through on treatment. I no longer felt alone. I volunteered at the ALF to educate the community and became a patient advocate, traveling to Albany and Washington to make legislators aware of hepatitis and its effects. In 1991, I became the organizer and facilitator of a hepatitis C support group at NYU Medical Center, which lasted over 18 years. I saw patients through those nightmare days of interferon, through these momentous times of the new generation DAAs. The difference is like day and night. In 2010, I took my passion for helping others one step further and started my own nonprofit organization, the Hepatitis C Mentor and Support Group, to address the lack of education and supportive services for people living with hepatitis C and co-infection, HIV and hepatitis C. Since I became involved, it is truly remarkable how much progress has been made in the treatment of hepatitis C. With the DAAs, most patients have the chance to be cured, drugs with a shorter treatment time and fewer side effects. Over 3 years ago, I was one of the fortunate ones to have access to the new treatments, and I am thrilled to say the virus is no longer detected in my body. Until you clear this virus, no one has an idea of how much it impacted their whole being. After living with hepatitis C for 20 or 30 years, it is awakening to realize what normal is supposed to feel like, not what you've become accustomed to feeling like. My cognitive skills have improved. I have less joint pain, less fatigue, and the nerve damage in my leg is beginning to regenerate. I call this the power of the cure. While a cure should mark an incredible time of rejoicing among the community, we are seeing restrictions put on as to who should get access to the meds in some states. We must all become effective advocates and make our voices heard. Regardless of race, gender, sexual orientation, or economic status, everyone deserves the right to be treated. You must be your own health advocate, and for those who can't, some of us need to speak louder. Patients must never give up hope. One more message I want to leave you all with is you need to ask your provider to be tested, especially those born between 1945 and 1965. This test is not part of your routine labs. Thank you.
Thank you so much, Rani. Really, really appreciate both hearing your story as well as the remarkable change in your health after being treated for hepatitis B. So in the interest of time, I'd like to move on. And next slide, please. Just note that an estimated 1 in 12 Asian Americans and Pacific Islanders are living with hepatitis B infection, and many don't know they're infected. So I'm very happy today to welcome Alan Wang, who is actually award-winning journalist and founder of NewsWorthy Media, who has also now turned some of his attention to talking about and advocating for awareness and testing for hepatitis B. Alan, are you here?
I am. Thank you for inviting me to speak on behalf of the many Asian Americans who are infected with hepatitis B. I just wanted to start by explaining to you how I contracted it. Through just connecting the dots on our own amongst the family, we figured that we had contracted it at birth. All of the 4 siblings in my family, I was the only chronically infected one of the 4 of us. We figured that out on our own. We all found out we were Hep B positive by going to our doctors. By 2 of my siblings tried to donate blood. They were rejected. At the time when I was diagnosed, I had a liver flare-up. Went to the doctor. At the time, the information was very inconsistent. The doctor essentially told me to stop drinking alcohol and really didn't give me the full information I needed at the time. And there was a lack of history on our family history documentation. So I kind of went through life. I was an active news reporter and anchor trying to move up in life, and because the symptoms are asymptomatic, I put it on the back burner and really didn't do enough for myself until I began dating my wife-to-be in Fresno, California, where I was working at the ABC affiliate there, and I think you see a picture of her there. Those are back in the good old days, and unfortunately I infected her. At that time, she said, I think we need to really get a grip on this and figure out what's going on here. So we educated ourselves. And because of that, I hooked up with a doctor named Dr. Robert Gish. You may be familiar with him. He's a leading hepatologist. And at the time, I had 13 million copies of the virus attacking my liver. And within 3 months of being on treatment, I was undetectable. And for the past decade, I've been undetectable, and we did an MRI last May, and Dr. Gish said, Alan, you know, because we've been able to suppress this virus, your liver has actually regenerated, the scarring is gone, and your liver looks as healthy as anybody else's. So, you know, that's kind of the sad thing about this, is that there are so many people who could do something about it. They can be treated if they just knew. And so because it is, you would think it was a relatively easy solution just to let people know, but it's not. I decided to start speaking out publicly for this, and I had a conversation with the news director at my TV station, and just to make sure, you know, because of the stigmas attached, that this would be good, and he backed me up on it. And I've since covered stories. I've gone on air on this news set talking about my struggle with Hep B, and I've worn my jade ribbon. So I have had some great opportunities to get out there, but even though I've been featured in a documentary film called Be About It with my family, I hope you watch it, I still feel like we are just chipping away at a giant block of ignorance and we really haven't made much progress. Right now, we're trying to get this documentary film called Be About It worldwide. It's got language captions on it, and if you are interested, go to hepbsmart.com and you can get a free DVD and have your own screening. I highly encourage it. It's an incredible documentary film. I thought it was going to be very corporate-like, but it turned out to be, it's like an emotional roller coaster for 40 minutes, and it inspires people to do something about it. I'm sorry I'm being long-winded here, but what I've come to realize is that, or I wonder why Hep B receives 4% of what HIV funding gets, despite the disproportionate numbers of those infected, is because of something my wife said. And she said, Alan, I think, you guys go to Capitol Hill, you say your piece, you lobby, and the senators come down and they take their pictures with you, and it's hello and goodbye, and they've got their photo to show that they've been serving their constituents. But for the most part, she says, Alan, this isn't seen as an Asian disease or a non-white disease, and until it becomes a threat to the majority of the population, at least here in the United States, nobody's listening. And so we've really got to get together and form a strong lobby, because what I've noticed is that from when I go to speak at these medical conferences and as a speaker for the Hep B Free campaign in San Francisco, I meet all of these people who are tucked away in hospitals and health departments, and they're advocates for this, and everybody's kind of doing their job, trying to get the word out, but there's no unified coalition or lobby that's pounding away at the right people. And this is maybe I'm wrong, but that's the feeling I get, because I just meet so many people who at these gatherings who meet each other and go, oh, I didn't even know you were there. And so until I think we create a really strong lobby and coalition of advocates and medical professionals, I feel like we're not going to get the attention that we need here.
Well, thank you so much, Alan. I think that your point is really important, that that we do need to join together and find other groups and other models and other sort of ways to work effectively together. I really couldn't agree more, and I hope that in some ways that the National Viral Hepatitis Action Plan can support the hepatitis B community, the hepatitis C community, all of us to come together and really do more, and do more even more effectively. So appreciate your encouragement there.
Yeah, and I will say, just kind of, Rich, from my perspective, being in Washington, I will say that there are a number of advocates that really are extremely good at their jobs and dedicated and are up on the Hill all the time, making the case and coming to see us and make the case as well. I do feel like the governmental responsibility, just to kind of say real quickly that we can't use this call for lobbying. This is an informational call. The intent here is not to bring people together to go lobby Congress for any specific reason or purpose. So we'll have to kind of put a bookmark in that, and I'm sure people can Google you, Alan, and find you if they want to. But
and your story.
Yeah, but thank you for sharing your perspective. It really was important.
Sure. Thanks for inviting me.
Thanks, Alan. Next slide, please. So we're going to talk a few minutes here about the African American community, which is disproportionately affected with hepatitis C, though African Americans make up about 11% of the total U.S. population. They account for about 25% of all people living with hepatitis C. We've also seen higher rates of hepatitis B among African Americans as well. But with that, I want to move on to introduce Thomas Green, who is here with us today as a patient. He's also a community mobilization coordinator at Community Access Services in New York, here to share his experience as both a patient, I think, as well as now working in the field. Thomas, are you with us? Is that you, Thomas? Perhaps you had muted yourself unintentionally. We can kind of check on the status of Thomas and maybe just move on in the, to save time, and we'll come back to Thomas when he joins the call again. So we'll hear from Thomas a little bit later. Next slide, please. Have another one of our really important groups. We know that American Indians and Alaska Natives have death rates that are very high, more than double compared to the national rate when it comes to hepatitis C. And really excited to hear from Gaye Wheeler, next slide please, about her experiences with the Cherokee Nation and as a patient and counselor. Gaye, are you on the line today?
Well, my name is Gaye Wheeler, and I was cured of hepatitis C in 2015. I am a Cherokee citizen and was getting medical services through Cherokee Nation Health Services at Three Rivers Clinic in Muskogee, Oklahoma. After having a routine medical checkup at the clinic, I was called and informed that I was diagnosed with hepatitis C. My response back was, I was unaware that I was even being tested for hepatitis C. The nurse told me that any individual that came through the clinic for services and was born between certain ages, she said, the hippie age, are being tested. Honestly, I was shocked because I have been sober for 22 years and really thought I had avoided the virus somehow. Although I had been experiencing fatigue in the last month and couldn't understand why, now it was clear to me. I always wondered why everybody I used drugs with in the past had been diagnosed with hepatitis C and I had not. Later on, I learned the virus can lay dormant in your body or that your immune system is able to fight it off. Another interesting fact I learned was if the medical profession was not specifically testing for the virus, it would not be detected. Immediately, I thought about the medication that friends and family members had to take when they were diagnosed, which was interferon injections, and I witnessed how they were affected by that certain medicine. I remembered how hard it was for each one of them and how they struggled with it. I was worried and scared that I would have to do that too. But on my first visit with Dr. Anna Miller and her nurse at the time, Amanda Hicks, all my fears and concerns were gone. Dr. Miller and Amanda were both wonderful and took the time to explain the process to me and answered all questions I had. They certainly made me feel comfortable about the whole process. I found out that I was genotype 1 and took Harvoni for approximately 12 weeks, and I was cured. I am now employed with Cherokee Nation Behavioral Health, where I counsel individuals with substance abuse disorders, and one of the first questions to them that I have for them is, have you been tested for hepatitis C? I also started counseling hepatitis C patients 2 hours a week at our Hastings Hospital in Tahlequah, Oklahoma, something I wanted to do ever since my experience with the virus. I really am glad that Cherokee Nation Health Services launched the Hepatitis C Elimination Project. I'm proud of them, and I'm grateful they were able to help someone like me from the hippie age.
Thanks so much, Gail. Loved your story and really appreciate, not only you sharing it with us, but, you really kind of taking your experience and taking, your journey and using that to help other people as well. And I think that's really makes such a difference. So thank you so much for being here with us today, and thank you for everything that you do.
You bet. Thank you.
So moving along, I think we have a speaker here today who's going to speak to the kind of emerging problem of hepatitis C among pregnant women. It was mentioned earlier, but we've seen a 200% increase in rates of chronic hepatitis C among women who are pregnant. Next slide, please. And so I'd like to welcome Megan Bhatti, who is an HCV adherence manager. Now, because this is such a new kind of area for exploration and for care, and these women don't, we don't have a tools for perinatal hepatitis C yet. Megan is going to talk a little bit about the challenges and some of the opportunities that she sees with the patients she works with. Thanks, Megan.
Hi, thank you for that lovely introduction. My name is Meg Bhatti, and I'm a hepatitis C adherence nurse in Buffalo, New York, which is in Western New York. I did a little bit of extra research. We've had a lot of women coming through the clinic. I'll describe a little bit about our clinic. We're kind of a, we call it kind of a harm reduction center in Buffalo, where we offer primary care, specialty care, including HIV and hepatitis C. We have an STI clinic, mental health services, a food pantry, substance use and counseling, a syringe exchange, and we also have care coordination services all out of one building. So a lot of times we're able to connect with people in a different way than say a regular traditional primary care office would. So we get a lot of people who have said, oh, I've been, I was told that I had high liver enzymes, or I was told that I had an antibody positive against, hepatitis C, and now I'm pregnant. I want to get treated. And the difficult part of that right now is that we don't have any tools to treat pregnant women who have hepatitis C at this time. There's no data, no studies for women who are pregnant and taking hepatitis C medications. And there is a possibility of vertical transmission from mom to baby, but it is low. It's only about 1 to 8%. I'm not sure what the hepatitis B rates of transmission are, but for hepatitis C specifically, it is a little bit low. However, there's not really anything that they can do to prevent that type of transmission. I did look into the differences between cesarean section and vaginal births and deliveries, and women who had lacerations or episiotomies during delivery did have a higher risk of transmitting the virus to their baby, and also those who had an extremely high viral load also were more likely to pass it along to their baby. So what we recommend during pregnancy is that women take, as best care of themselves as holistically as possible. So focusing on not only their physical health, but their emotional, spiritual health as well, so that they can be as healthy as possible for them and their future child. We also have syringe exchange, and we're a harm reduction facility, which means people don't need to abstain from substances while getting services here. We link them with our syringe exchange so that they can use safely. They're also connected with a counselor at the syringe exchange who can teach them or educate them on safer injecting sites and how to protect themselves from spreading and from receiving hepatitis C. So it's a really cool, unique place that we have here, and we're getting constant connections and constant phone calls about, hey, I just got diagnosed, when can I get in? So we've recently revamped our process of intaking patients who want to receive treatment, because treatment now is much faster than it was before. And we are, fingers crossed, lucky to be living in New York State because we do have less less restrictions on who we can treat, so people don't need to be in the 3rd and 4th stages of liver disease in order to get treated. So we have been able to get people through and treated in anywhere between 8 and 12 weeks to be cured from hepatitis C. So we've had a lot of success, but we know that there's still a lot of people that we're not reaching. So we're doing crazy things, awesome things to try and get everybody who needs care into care and safe care.
Thanks, Meg. So just one follow-on question I had for you about women who are pregnant who have hepatitis C. Have you had success in following up with them to treat them after they have their babies?
I have not had any women come through yet that have completed their pregnancies. So we haven't. I have 3 people right now who are in their 9 months, ready to finish, ready to be moms, and but are not. They're not eligible just yet for treatment. But they can additionally, after they've given birth, they can go through treatment, and as long as it's not spread through breast milk. So as long as women are not having a blood-to-blood interaction with baby, they're safe to breastfeed, and then eventually we'll treat them after that, because we do not know the effects of breastfeeding that the medication would have on baby.
Sure. And the good news is that after a woman is cured, she's then very unlikely to transmit hepatitis, or perhaps even impossible, but I think the research isn't quite there yet. Very, very unlikely then to transmit hepatitis C if there were a future pregnancy. Thank you so much.
So that prevention is actually treatment. So before pregnancy, if they're planning on getting pregnant, we say, get cured first.
Great. That's a great message to give women who are thinking about pregnancy who have hepatitis C. Thank you so much for having me. Absolutely. So moving on, in the interest of time, next slide, please. For hepatitis B, and we've gotten a couple of comments. We know that Hep B and Hep C are very, very different viruses. Hepatitis B is very easily transmitted from an infected mother to her infants at the time of birth if the proper steps are not taken. And for infants who are born with hepatitis B, 1 in 4 will die prematurely of hepatitis B-related causes. So next slide, please. We are joined today by Sue Wang, who is both a patient as well as a physician. I've had the opportunity to work for a number of years with Sue, who has just been tremendous in terms of developing programs to meet the needs of women with hepatitis B, perinatal prevention programs that she's worked on herself, but also as a person living with hepatitis B, she's here to share some of her story with us. Sue, are you here? We think we see Sue on the webinar.
Oh wait, I'm here. Can you hear me?
Yay! Yes, Sue.
I'm here. I started speaking. I realized I had self-muted myself. I'm very happy to be here. This is obviously a issue that's near and dear to my heart, and so I'm happy to share about this as both a physician and a patient. And so my story is that I had donated blood as a freshman in college and received a letter that I had tested positive for hepatitis B, which is sounding like a very common way people find out. I was in shock, as I had no idea what that meant at the time or how I had gotten it. So I called my sister, my best friend, and told her not to tell her parents. And she replied, "Oh, Mom has Hep B, didn't you know?" This is a great example of how Asian families communicate or don't. So during college, I wrestled with whether I needed to tell friends, my boyfriend, and if I needed to do anything else differently. And I've learned since that this kind of psychosocial impact of the diagnosis, which includes the fear of being stigmatized, is commonly what actually causes great suffering in people with Hep B, more so than the symptoms themselves. So I went on to med school and did a combined medicine pediatrics residency where I got to learn more about hepatitis medically. And I was lucky that I had a lot of friends who went into infectious disease and kept me up to date with the current recommendations. And I was fortunate that my viral load was always low and I didn't need treatment. So I realize also now that I was really fortunate that I didn't face any discrimination during this time. I've since heard that there are a number of students who have had their med school acceptances rescinded, and even residents who have been dismissed based on their hepatitis B status. In 2012, the Department of Justice investigated several of these cases, and they issued a statement that discriminating based on Hep B status is an illegal practice, and those schools were fined. CDC then followed up with recommendations on students and healthcare workers with Hep B and concluded that having Hep B does not preclude one from practicing medicine, surgery, or any other health profession. And I have to say I was honored to be a part of that committee, and it's something that has been circulated across the med schools in the U.S., but continues to be an issue. And if any of you hear of cases of this happening, the DOJ actively investigates all these cases. So following my fellowship, which I did at the CDC, I went on to work at a federally qualified health center, the Charles B. Wang Community Health Center in New York City. So I learned there a lot about taking care of the Asian American population, and as part of that, I became very familiar with the management of patients with hepatitis B. So it wasn't right away, but after a few years, I came out about being a patient myself. So I'll admit, it was not planned. It all happened through a very good interviewer who interviewed me for a CDC interview, who must have taken lessons from Barbara Walters. And I started naturally just talking about my own diagnosis. So it's interesting, though, being a patient and a physician for hepatitis B and knowing when to mention my own diagnosis. I don't bring it up all the time, but I find that for some patients, it is really helpful for them to hear that I go through the same things as them, living with this disease and having to see doctors regularly. I also know very well the difficulty we in this hepatitis community have in finding Hep B patients who are willing to talk about their own experiences. So I do feel that it is my responsibility to be an advocate as a patient and not just a provider. I've since joined the board of the World Hepatitis Alliance, which is an international patient-based advocacy group and the brains behind World Hepatitis Day. I've learned from them and other people who are involved with the Alliance how important it is for patients to speak up, and that as physicians, providers, and policymakers, we should always keep the patients at the center of what we do. So I feel like the biggest success story that I live out every day is that I have 4 kids who are free of hepatitis B, and you see their pictures here. I was obviously super vigilant about getting my hepatitis B test during pregnancy and made triply sure that all the babies got HBIG and Hep B vaccine within 12 hours, that they finished their vaccines and also got their Hep B test to confirm their immunity. I actually became very good friends with the health department, as the nurses would call me to confirm immunity, and they would know that I was doing the work and also that they needed to get my baby's reports get to them as part of CDC's perinatal hepatitis B program. So when I still hear that 1,000 babies a year are getting hepatitis, I can only imagine the burden those moms feel, knowing that they passed on this lifelong disease to their kids and it was preventable. Working in the healthcare field, though, I see how this happens. The healthcare system is hard to navigate, access to specialists can be spotty, recommendations are not always followed, medical errors happen, hospitals don't have policies, and so vaccines are missed, and high-risk pregnancies are not identified or treated with antivirals. So in the end, what is preventable is not prevented, and these babies get infected. Our national hepatitis B birth dose rate is only 69%. And it should be 100%. All babies born in the U.S. should be getting a birth dose of hepatitis B before they leave the hospital. And now that is actually, the recommendation is they should get it within the first 24 hours of life. So many people think, oh, 69% doesn't sound so bad, but it actually falls short of many countries right around us, including Mexico, which is 90%. I believe this number is embarrassing for the U.S. and reflects our apathy. We in this community owe it to the 1,000 babies who get Hep B yearly to make the goal of 0 transmissions by 2020 a reality. Thank you.
Great. Thanks so much, Sue. And really, thank you for being honest, authentic, brave and true to yourself in telling your story and stepping outside of the physician role, and being a real person and talking about the impact that this infection has had on your life. I know that those kinds of connections are really the things that can change people's minds and make a real difference in how people understand and look at these issues. So thank you so much for the work that you do in the clinic and the work that you do just being you.